Hi, I'm Steve Paddock with the Castle Rock Fire and Rescue Department. This is my partner, Jake Otten. Today we're going to be just demonstrating the digital intubation scenario. First, we want to take BSI, which is eye protection, gloves, and possible masks. Today for this scenario, we're going to be wearing eye protection and gloves. First, we want to assess to make sure that the BLS airway that we're using is not effective. So with a proper BVM and OPA in, we're not able to bag our patient. So we want to determine the need for digital intubation versus other possible intubation attempts. Next, we're going to take our tube and inspect it. We want to make sure there's no damage, that the neck is properly seated into the tube, and we want to inflate our cuff to make sure there's no damage or holes to the cuff with a 10 cc syringe. We'll deflate our tube and prepare for the intubation. Now we're ready for the procedure. First, we're going to place the head in the snifting position with the head tilt chin lift method. If a spinal injury is suspected, we'd have an assistant hold the head and perform a jaw thrust maneuver. Now, if we were ventilating, we'd stop ventilating, remove the OPA, and open the mouth with a finger scissor technique. If sectioning was necessary, we did section now. Next, we're going to insert the index and middle finger of our dominant hand down the mouth, depressing the tongue. We're going to advance our fingers down to the epiglottis, lifting the epiglottis off the back of the pharynx. We're going to advance our fingers to the epiglottis, making a channel for the tube to be inserted between our index and middle finger. We're going to insert the tube through the glottic opening until the balloon cuff passes the glottic opening. For a better example or review with this mannequin, we're going to insert our dominant hand, middle and index finger, capturing the epiglottis, lifting it off the back of the throat. After that, we'd form an opening with our middle and index finger. Next, we'd insert the tube, guided down through our fingers, through the glottic opening until the balloon cuff passes. Next, we would secure the tube with our fingers to the teeth. Now, returning back to the mannequin, we'll secure the tube with our non-dominant hand against the teeth, slowly removing our dominant hand from the mouth. Next, we're going to inflate the balloon and then detach the syringe. We're then going to use a BVM and give ventilations. We're going to use at least two methods to confirm. One, we could use capnography with the tube in waveform. And second is we can use lung sounds. Listen over each lung, confirm good lung sounds, and that there's no epigastric sounds. If the tube is placed incorrectly, we would deflate the cuff, remove the tube, place an OPA in, and reventilate. Now we want to secure the tube with the tube tie. Continue ventilations. Go underneath the head. Secure in the crook of the mouth. And tie off. Reconfirming placement of the tube. We want to continually reassess our tube to make sure there's good placement. At this time, if there's a spinal injury, we'd apply the C-collar. And that concludes our digital intubation scenario.